Dr. Gonçalo Cotovio is with us today. He's a psychiatry resident and research associate at the Oliveira Maia Lab, otherwise known as the Champalimaud Foundation's Neuropsychiatry Unit. Gonçalo has recently been awarded a 2023 NARSAD Young Investigator Grant by the BBRF. Congratulations, Gonçalo.
Thank you.
We will use the abbreviations, but should mention that NARSAD is the National Alliance for Research on Schizophrenia and Depression, and NARSAD grants are awarded by the BBRF, or the Brain and Behavior Research Foundation, a North American organization that has been funding mental health research since 1981 and young investigator grants since 1987. This grant will fund ongoing work on lesional obsessive compulsive disorder, OCD, that Gonçalo is developing in collaboration with several members of the Neuropsychiatry Unit. The proposal is to use the results from this work to test a new treatment for OCD through transcranial magnetic stimulation, or TMS. TMS is a non-invasive procedure that uses magnetic fields to stimulate specific areas of the brain, which can relieve the symptoms of a variety of mental health and neurological disorders. The 2-year grant project we're talking about today will begin on January 15th, 2024, and continue until January 14th, 2026, and it will allow the Neuropsychiatry Unit to have its very first clinical trial with therapeutic TMS. So, Gonçalo, you must be very excited about this. Can you tell us what the idea of this project was from the beginning?
Yes, so thank you, John. It was a very nice introduction, by the way. Myself, I wouldn't do such a length introduction, but anyways, so I'm very excited. So this actually goes back a bit. So I was reviewing the process, and if we want to be if you want to be truly following the process, this needs to go back to 2014. So this was this is started with a simple case that was published, I guess, in 2014 or 2013, of a man, like let's call him Mr. A. And Mr. A was admitted in Centro Hospitalar Lisboa Ocidental, so in Hospital Egas Muniz, in the psychiatry ward, by my supervisor, my PhD supervisor, Albino Oliveira Maia. And this case was interesting because it was a 70-year-old man that started to become different than usual. So he was euphoric, so he was grandiose, so he had inflated self-esteem, so he was buying a lot of stuff, and he was admitted because of that. So they did the usual workup of such cases, and nothing came out. So he was treated, he was diagnosed back then with bipolar disorder, and a few months later, he started to become hemiplegic on the left side. So this means that he had some problems moving the left side of the body. And they repeat some of the work done before, including a brain imaging, and they noticed that this patient has this huge brain tumor in the frontal lobe, in the right frontal lobe, huge brain tumor that had developed like very fast in the 4 months previously. And this was a case of lesional mania. So people that had a change in behavior, they become manic, which is the behavior changes that I described, after a brain lesion. And this actually prompts an interest of doing more research in this field. And this is about, so this idea of going deeper in these cases goes back to the time where I started my let's call it internship here in research, as well as my residency in psychiatry in Hospital Egas Muniz. Here I'm in Champalimaud, in the Neuropsychiatry Unit. And I started working on these cases that me, Albino Oliveira Maia, Bernardo Barona Correia, started to notice in the inpatient unit in Schlo. And here in Champalimaud, we had also some cases. So we started to try to understand how can we further develop this line of research. And we started to think about finding strategies to find a specific spot where the lesions were located that origin this kind of manic behavior. And long story short, I decided to pursue this work while pursuing other path, which is in neuromodulation. So you mentioned in the introduction, transcranial magnetic stimulation. It's a brain stimulation strategy where we focally stimulate a region of the brain to improve the activity of that brain region and hopefully improve the patient clinically. This has been used mostly in depression. And so I decided to, on a separate way, pursue this path as well. And I decided to do a rotation in the United States in a Harvard-affiliated lab. And Albino told me, I was there before. You need to meet this guy, Michael Fox, which is a neurologist that has been working with lesions as well, but mostly lesions that cause neurological syndrome. And when I was there, I met Michael Fox, and he was thinking back then to start expanding this field of research of understanding lesions that cause syndromes to the psychiatry field. And so this kicked off a collaboration that is still ongoing. And we have published several papers on these lesional mania cases, and we understand mostly the specific spots of the brain that are hit by the lesions, but also the networks, the circuits that are associated to the lesions. And these publications had some buzz in the social media, and it was very interesting. This goes back to 2020, 2021, 2022. And actually, after we published this, some people started to ask us for these circuits, the maps of these circuits in mania, because they wanted to stimulate some specific spots of that circuits with TMS to treat mania. I really don't want to go deeper in the details why it is tough to do a TMS trial in mania, but you can imagine that people that are very agitated, very energetic, it's quite difficult to have them still to actually stimulate a certain region of the brain. But we were also starting here in Champalimaud by 2021, 2022, we were kicking off our OCD TMS program. We had already started our TMS for depression program, so this was in cruise control mode, but we were starting our OCD TMS program. And that's actually one of the things that was important for this project that I've won this award, which was we thought about if these guys are asking for our lesional mania circuits to define new spots to stimulate with TMS, can we actually do this kind of work with OCD? And that's exactly what we are planning to do. So what we are planning to do is go back to lesions, because lesions in the brain are somehow open windows to the neurobiology, to the circuits that are disturbed in a certain condition. And so we plan to go there, we plan to study people that developed OCD-like behavior after a brain lesion, and then define the circuits that are associated to that condition, and hopefully try to validate these circuits in a separate population that we are also conducting since the I don't want to have the dates wrong, but more or less around 2018, 2019. So in a different project in OCD. Actually, interestingly, this other project was also awarded the NARSAD grant from José Oliveira. I need to give kudos to José. So José also won a NARSAD grant for this other project, and we want to try to validate these lesional networks that we may find in this project in a different population, a population that developed OCD without a specific cause. So this is a truly cross-validation research. And then the cherry on top of the cake would be finding a specific spot that is cross-validated and that we can stimulate with this technique, TMS, and try to improve the clinical symptoms of OCD patients, which is a very disabling disease. And this is actually what we are proposing, and that's why I'm very excited. It's a very complex project, but I hope to get this done in these 2 years. I'm sure I will. I'm very goal-directed, so hopefully that will be true.
Great. Thank you, Gonçalo. That was a very complete answer. I do have a couple of questions. This is lesional OCD we're talking about. I think a lot of people listening, maybe like myself, would not associate OCD with brain lesions. Mm-hmm. How common, do you have any idea what percentage of OCD is caused by lesions as opposed to other?
In fact, it's difficult to understand the figures behind lesional OCD. Actually, it's difficult to understand the figures for any other condition that is, or any other psychiatric condition that is caused by lesions. There are some studies trying to answer this question, mainly in mood disorders or affective disorders, because it has been the bread and butter of the psychiatric field in terms of lesions causing syndromes. Lesions causing OCD is rather rare, but the figures go around 1 to 5%, which is not quite different from what have been described, for instance, for mania. For depression, which can be also caused by lesions in the brain, the numbers are a bit higher, but then there's a bias there because we know that people may be depressed because they have a lesion in the brain. So there's this redundant idea, so we need to figure out which are the regions in the brain that are actually... But there are some work in depression as well. Kudos to Michael Fox, who have been doing this as well.
Okay, so you talked about how this project you're involved in could help with the symptoms of OCD. What do you mean by that? What improvements are you hoping to see?
Okay, so obsessive compulsive disorder is a condition, a psychiatric condition that is characterized either or by obsessions, which is these recurrent thoughts thoughts that come to your mind repeatedly about something. So, for instance, that you are infected, or that things are not in order, or that you are not worthy of something, or these aggressive thoughts of hurting someone. And this is very anxiety-provoking, because people do not identify as this thought. They know, they feel that this is strange, this is not themselves. So they feel that this is they know that they are part of, the thoughts they are part of them, but they are not willing to have them. And sometimes they do these actions, these repetitive actions, mostly to alleviate some of these thoughts. There are some people that only have these kind of thoughts and don't have the acts, but there are people that only have the acts, and they do not identify any specific thought. But this is very disturbing for their daily life activities, because ultimately people can actually lose a lot of time, and they can have consequences. For instance, a person who is always thinking that they have germs in their hands might be washing the hands several times a day, losing, for instance, 2 hours washing the hands. So this is very disabling. Some people do not leave their homes because they think they can hurt someone. And so this is very disabling, and what we want is actually make this condition less impactful for the patients. We know that TMS, so transcranial magnetic stimulation, is already FDA cleared and received CE mark, this is for Europe, to be applied in TMS patients. But we also know that the percentage of remission and the percentage of response is not as high as we would like. And so this actually is one of the reasons why we are trying to pursue this work. We are trying to improve these figures.
And when you talk about the improvements that can be made with TMS, what kind of program are patients involved in? It's not a one-hit idea, right?
So what I can talk about now is the program that is already FDA cleared. And the program that is actually FDA cleared and has received also CE mark, so the TMS device has received CE mark to be applied in OCD, is a program, it's a very complex program. We actually have written a paper about it. I'll talk about that in a minute. But the program implies that you need to be on a daily basis, so weekly days, coming to a clinic, to a TMS clinic, and receiving 20 minutes of TMS in a certain region of the brain. Moreover, you need to be there because you will do, let's call it exposure-like therapy, which we know that is also important and it's effective to treat OCD. What I mean by exposure therapy, we call it in TMS as provocation symptoms. So this is the paper that we have written. So in TMS, before we do the application of the technique, we actually make the patients think about their obsessions or their compulsions in order to engage them in a state that they are anxious, not too much anxious, but not too little as well, in order to stimulate then the region that it is believed by the field that is responsible for that anxiety and for that feeling of need to pursue the task. The paper that we have written I think it's a very beautiful paper because this is the recommended strategy, but there was no specific way to train the professionals how to perform in the provocation symptom. Let's call it therapy. And so we have developed here in Champalimaud a curriculum, a training program for those that are starting to do their TMS OCD programs in order to have their technicians trained to provoke symptoms in OCD.
Yeah,
and this was published by Anna Maya, so kudos again to Anna Maya.
What kind of examples do you mean? How do you provoke somebody's OCD?
So here in our TMS OCD program, what we do is we after the patient being referred to TMS, the patient needs to have an appointment with a neuropsychologist that is also specialized in assessing OCD symptoms, and we have this thorough assessment of OCD symptoms. During this assessment, the neuropsychologist will draw a hierarchy of symptoms from the less anxiety-provoking to the most anxiety-provoking. And the neuropsychologist can also develop examples of strategies that you might use to elicit such symptom. So, for instance, if someone is very concerned about, let's call it germs, the example that I gave you before. So the first thing could be, I'm not saying it is, but could be, think about an occasion where you felt your hands were not clean. And the patient starts thinking about it. Then the next level could be doing an inception. So basically asking, are you sure your hands are clean? I'm seeing something there. So and this will increase, reaching the point to, for instance, asking the patient to grab something, physically grab something that they feel is not clean and stay there.
Okay. So there has to be a certain level of...
Exactly. So this is, I gave it 3 examples in increase anxiety, that increase your anxiety level in order, right? So, and this will not be performed in a single session, of course. This will be done at the patient's rhythm, and not in a single session, during the whole treatment strategy, so during the whole treatment program, which is about 30 sessions.
Okay. And how will this grant help you with this project? What does this grant mean for your work?
Yeah, the grant is critical for this project, not for the TMS program, but the project that I was talking about. So to pursue this project, we need to have this task force to do the lesional part of the work, to do the cross-validation. So the data is already collected for the primary OCD, because as I mentioned, this was in a separate project. We are only taking advantage of that so we can use it for our own. But so the lesional part, trying to have, let's call it computerized force to do the analysis, that's for sure. But one of the core will be the conduction of a clinical trial that potentially will be the cherry on the top, as I said, will validate the network that we have suggested. So the bulk of the grant will be for the clinical trial.
Excellent, excellent. So this project lasts until 2026.
Yeah.
This question might be outside the remit of what we're talking about today, but where do you see this going after that?
Oh, the goal, if this runs very smoothly and if we are right, I think the next goal would be actually approve these new TMS targets for OCD with a multi-center, large clinical trial, probably international.
Okay.
So this is the way we actually are able in clinical research to validate our own preliminary findings and make them generalizable to a bunch of patients in this case. And ultimately, if the trial goes well, if the multi-center clinical trial goes well, hopefully this will be added to the TMS clearance documents as another spot that you can use to treat OCD. Probably even better, hopefully even better, with better results, I mean.
Thank you, Dr. Gonçalo. It was very nice talking to you today.
Thank you, John. It was a pleasure.